Ventricles, RAD 310, Sectional Anatomy, Bachelor of Science in Medical Imaging program, Chris Gibbons, instructor. In this media module, we'll study the ventricles and cisterns of the brain. There are several conditions that can affect the size and shape of ventricles, so their shape and size and position are critical part of analysis of sectional images of the brain. Hydrocephalus, which literally means water brain, is a condition in which there's a problem with the cerebrospinal fluid and its circulation. This MR image demonstrates enlarged lateral ventricles and dilated soluci due to hydrocephalus. Upon completion of this media module, you should be able to 1. Describe the ventricles of the brain, including their communicating foramina. 2. Identify basilar or subarachnoid cisterns, including their key characteristics. 3. Explain the location and function of the choroid plexus. 4. Identify the ventricles, cistern, and choroid plexus on sectional images. The ventricles of the brain are filled with cerebrospinal fluid, or CSF for short. There are 4 ventricles: 2 lateral ventricles, the 3rd ventricle, and the 4th ventricle. This is an interior view of the ventricles to give you a different perspective versus the sagittal view that we saw in the previous slide. The lateral ventricles are the largest. Each one is located within its corresponding cerebral hemisphere in the medial aspect. The lateral ventricles are separated from each other by the septum pellucidum. The lateral ventricles have 3 projections, termed horns, located on the front, back, and bottom of each ventricle. The anterior horns project into the frontal lobe of the cerebral hemisphere. The posterior horns extend into the occipital lobes, while the inferior horns project into the temporal lobes. You may hear many references of the inferior horns referred to as the temporal horns. The lateral ventricles communicate with the 3rd ventricle and indirectly with each other via the interventricular foramen, also termed the foramen of Monro. The 3rd ventricle is located in the midline of the brain, inferior to the lateral ventricles. Note the long tube that connects the 3rd and 4th ventricles. This is the cerebral aqueduct, but may also be termed the aqueduct of Sylvius. Notice that this view from the top of the head that the 3rd ventricle is very thin and situated right between the lateral ventricles. So in an axial image, the 3rd ventricle appears as a narrow slit-like structure in the midline of the normal brain. The more inferior ventricle is the 4th ventricle. The 4th ventricle is rather diamond-shaped. 3 openings allow for the flow of CSF into the cisterna magna and the subarachnoid space of the spinal cord. The openings are 2 lateral foramina, or foramen of Luschka, and 1 median foramen, also called the foramen of Meningi. The choroid plexus are specialized capillary bundles that project from the pia mater into the ventricles. The choroid plexus produce cerebrospinal fluid, which circulates through the ventricles and subarachnoid space of the central nervous system. The flow is from the lateral ventricles through the interventricular foramen to the 3rd ventricle, through the cerebral aqueduct into the 4th ventricle, and out to the lateral foramen and median foramen into the cerebral cord meninges. CSF is absorbed into the venous blood by the arachnoid villi, tiny fingerlings of arachnoid membrane that project into the venous sinus of the brain. The cisterns of the brain are areas in which the normally narrow subarachnoid space expands. These small chambers are called subarachnoid or basilar cisterns. We have the supracella cistern, located above the sella turcica, contains the optic chiasm and the circle of Willis. The ambient cistern that tracks in the lateral midbrain connects the interpeduncular and quadrangenital cisterns. The quadrangenital cistern, located between the splendinium of the corpus callosum and superior to the cerebellum. Also, we have the cisterna magna, one of the largest cisterns located in the lower posterior fossa, between the medulla oblongata, the occipital bone, and the hemispheres of the cerebellum. And also of important note is the cisterna magna is continuous with the subarachnoid space of the spinal canal. This axial T1 weighted MR image demonstrates the frontal or anterior horns of the lateral ventricles, as well as the occipital or posterior horns of the lateral ventricles. Within the posterior horn of the lateral ventricle on the patient's right side, the choroid plexus is labeled. The genu of the corpus callosum is labeled in the anterior midline portion just above the anterior horns. There are also some basal nuclei labeled, which you will want to review. So this may be a good time to pause the video and work your way around this image and study the anatomy. This is an axial T1 weighted MR image. On each side of the longitudinal fissure, the body of the two lateral ventricles are well demonstrated. The gray shadows within the ventricles are the choroid plexus, which produces the cerebral spinal fluid. This is an axial MR image at the level of the third ventricle. The third ventricle is a small, thin opening when viewed in an axial section. It is located in the midline, close to the anterior horns of the lateral ventricles. Towards the posterior aspect, notice the posterior or occipital horns of the lateral ventricles. Gray shadows are seen within the occipital horns of the lateral ventricles. This is the choroid plexus, which secretes CSF. Finally, the opening between the lateral ventricles and the third ventricle, the interventricular foramen, or may be called the foramen of Monroe, is also seen just above the opening of the third ventricle. This image is provided to demonstrate the presentation of that fourth ventricle on axial images. Again, this is a T1 weighted MR image, and the fourth ventricle is visible posterior to the pons. There are other labeled structures in this image that you'll want to study, so again, you may want to pause the video here and work your way around this image. Again, another T1 weighted coronal MR image. Focus on the middle of the image and note the wing-shaped lateral ventricles. Just inferior to these, in the midline, is a thin opening that is the third ventricle. As with a lot of the other images presented in this media module, there are many other labeled structures. Again, take a moment to pause the video and work yourself around the image presented and look at the identified anatomy. This image is a coronal T2 weighted MR image, so in this case, the CSF is bright white, and the white matter demonstrates darker than the gray matter. The fourth ventricle is of interest, and it's seen in the middle of the cerebellum as a thin slit of bright white due to the presence of CSF. The ventricle is small at this level and would appear larger if the section were slightly more anterior. This is an axial T2 weighted MR image, demonstrating several of the subarachnoid cisterns. Since CSF fills the cisterns, they are bright white on this T2 image. Start at the most anterior and find the midline bright structure. This is the supracella cistern. Just below it, in the space between the cerebral peduncles, is the inner peduncular cistern. Look on the lateral side of the cerebral peduncles and find the ambient cistern. Follow it around posteriorly and note the quadragenital cistern adjacent to the corpora quadragenital, or body of the quadragenital.